At Buckeye Health Plan, we start our day early and we stay late, doing whatever it takes to see you through. Whether it's getting through a health crisis or a well-child checkup, Buckeye provides access to the services and support you need to be your best. From healthcare to vision and dental services, behavioral health and pharmacy, Buckeye's large network of healthcare professionals shares our commitment to your health and well-being. Every day, all day, our 24-hour nurse advice line is here to give you the answers you need. Our care managers know you, care for you, and come alongside you at the doctor, at the hospital, and at home. Our drivers will get you to your medical appointments and the pharmacy. We're Buckeye Health Plan, the people you know and trust to help you get well and stay well. You've seen us in your community, feeding the hungry, providing books to early readers, helping students make friends at school. Our smiles, our commitment, our joy in serving you are all part of our vision to transform the health of the community, one person at a time.
Hi everyone, this is Chris Peltier, and I'm the President-elect of the Ohio chapter of the American Academy of Pediatrics. I'm here to invite all of you to attend our annual meeting on November 20th and 21st. Unfortunately, due to the COVID-19 pandemic, the chapter has decided this year to transform our annual meeting into a virtual meeting. However, we're excited about the opportunity to present the meeting in this format. The meeting will still contain the same timely educational and advocacy topics that will be presented in person, along with many new ways to connect. Topics this year include adolescent vaping, COVID-19 and practice transformation, infant mortality, teen suicide, and the top 10 articles in pediatrics from the past year. We are also thrilled to welcome Mark Del Monte, the National AAP CEO, who's going to give us a federal advocacy update. We are working to make the meeting as interactive as possible so that attendees can talk and network with presenters, chapter leaders, and other attendees. We will also have a virtual exhibit hall where you can interact with industry representatives through virtual chats. And the best news is that the virtual annual meeting is free. That's right, I said free for all chapter members. If you have never attended an annual meeting before, this is the year to do it. You can earn up to 29 CME and MOC Part 2 points, all from the comfort of your couch. We look forward to seeing and interacting with everyone virtually in November. For more details and to register, please visit our website, ohioaap.org, or find us on Twitter and Facebook. See you all in November.
Hello, my name is Dr. Robert Frank. I'm a pediatric infectious disease physician at Cincinnati Children's Hospital and the medical director for the Moby and Ties program, which are co-sponsored by the Ohio chapter of the AAP and the Ohio Department of Health to promote vaccination of our children. We know that COVID has really put a damper in medical care and changed our lives dramatically, including many children delaying their routine child care and immunizations. To keep everyone safe, we've developed online modules for Moby and Ties. We also have added a module about COVID and how you can try to limit the spread of the infection. We hope that you'll contact the Ohio chapter of the AAP to schedule your virtual Moby and Ties presentation. Thank you for everything you do, and stay safe.
Hey everyone! I've got some exciting news. The Parenting in Mealtime and Playtime program is transitioning this fall from a QI to a training program for providers and primary care staff, which means that you're still going to have access to all of the awesome resources that PMP has to offer. But we're also going to have a toolkit, some new webinars, and some web-based programs to help you get through COVID, as well as some CME and some MOC credit. PMP is a great program that will not only continue to focus in those first 1,000 days, but also stretch through childhood into adolescence. So whether you're new to the program or you've done it before, you are not going to want to miss this.
Might give the itchy jump to everyone you touch. Don't itch it, don't scratch it, though you want to very much. Or you might give the itchy jump to everyone you touch. Itch, itch, itch. I know I mustn't scratch, well I gotta resist. That itch, itch, itch. Itch, itch, itch. I know I mustn't scratch, well I gotta resist. That itch, itch, itch. Don't itch it, don't scratch it, though you want to very much. Or you might give the itchy jump to everyone. It's Charlie Chicago. Itch, itch, itch. I know I mustn't scratch, well I gotta resist. That itch, itch, itch. Itch, itch, itch. I know I mustn't scratch, well I gotta resist. That itch, itch, itch. Gonna itch, itch, itch. I know I mustn't scratch, well I gotta resist. That itch, itch, itch. Itch, itch, itch.
Hi all, my name is Jamie Macklin and I'm a pediatrician at Nationwide Children's Hospital in Columbus. I'd like to invite all of you to participate in the Ohio AAP's newest quality improvement endeavor, the Implicit Project. Implicit stands for Interventions that Minimize Preterm and Low Birth Weight Infants Through Continuous Improvement Techniques. It utilizes quality improvement science to address factors that can lead to preterm and low birth weight infants and infant mortality during well-child visits. Pediatricians will learn how to counsel the mothers of their young patients on factors such as appropriate birth spacing, depression and anxiety, tobacco abuse, and multivitamin use in order to promote healthier future pregnancies. Stay tuned for further details and enrollment information during this year's Ohio AAP annual meeting in November. Thanks, and I hope to work with all of you very soon.
As pediatricians, we know that kids are not just small adults, and the same holds true for teens. But they aren't just big kids either. They have unique developmental needs, and reproductive health is just one of them. Luckily, the Ohio AAP is here to help as always. The Adolescent Health LARC program is a practice coaching project that helps your clinic meet those important reproductive health needs, like preventing unplanned pregnancy, supporting healthy relationships, and addressing adolescent menstrual issues while also helping you integrate long-acting reversible contraceptive services like the implant into your practice. Our goal is to help your entire clinic create a youth-friendly culture that supports teens' development needs and supports you in the process. You do the hard work every day supporting the unique health needs of kids and adolescents of all ages. Let us help support you in your job as we work together to keep Ohio's youth healthy and thriving. Contact the chapter today for more information.
In the emergency department the other day, a mom asked me if she could go out for a smoke while waiting for her test results. I wish I could get her to quit, and then I thought the Ohio AAP has a program that could help. Did you know 4 in 10 infants are exposed to secondhand smoke? It's linked to infants having more respiratory illnesses, ear infections, and sudden death. Many moms might quit smoking when pregnant, but then start again due to the stress of a newborn in the home. Smoke-Free Families is a quality improvement program in pediatric practices. In this program, pediatricians use the 5 A's of smoking cessation with moms of children less than 1 year of age. In just the first year, 16 practices with 60 providers participated. 7,289 screens were performed, and 16% of infants were exposed to secondhand smoke. After pediatrician counseling, by the child's next visit, caregivers reported more than 50% reduction in child smoke exposure, and 34% of caregivers quit smoking. We're recruiting for another wave of smoke-free families, and if interested in participating, contact Haley Southworth at the Ohio AAP, or you can email her at hsouthworth@ohioaap.org. Let's help make all of the families we care for smoke-free.